Welcome back, and if you're just tuning in, you're listening to HealthTech Talk, broadcasting from iHeartRadio Studios, 640 WGST, and streaming worldwide on the iHeartRadio network. My name is Ben Chodor, and I got to tell you, I'm really excited about the next two segments, the rest of the show. Not only do I have Dave Barnes back, we're going to talk some apps, and he's going to help out, but more importantly, I have someone that I have more respect for than most people. So I'm a mentor at an organization called Blueprint Health, and one of the first classes they had, there was this little startup company called GeriJoy that I fell in love with, not only their technology, but their CEO. Their CEO is like a rocket scientist. He went to MIT. He's one of the smartest guys, one of the most loving guys, and one of the most passionate entrepreneurs I've ever met in the industry. So you can tell in my voice, I'm really excited. So his company is called GeriJoy. I don't want to give it away. I'm going to have him tell you about it. But just the name, GeriJoy, has to make you smile. You can check it out at www.GeriJoy.com or check him out at Twitter at GeriJoy. And with me is the CEO, founder, Victor Wang. Victor, how are you, my friend?
I'm great. Thanks so much, man. That was flattering of a description. I'm really happy to be here.
So, it's great. I don't know. How many years ago were you on Blueprint? 2 years ago?
Something like that. Yeah, it feels like forever.
So but you were great. You were one company that really stood out. And to me, to just tell my audience, because this not only was a product that helped patients, all right, but at the same point, help loved ones engage with their patients. But I don't want to tell you what the product is. Tell my audience so they get a picture in their head. What is GeriJoy, and why'd you create it?
So what GeriJoy does is we engage patients and we coach them to improve self-management of their clinical risk factors. And we do that by addressing these clinical risk factors as well as by providing round-the-clock psychosocial support. And so when patients use the GeriJoy product, they're simply talking with a captivating avatar. And this avatar serves as a continuous face for GeriJoy's global team of specially trained health advocates. So we talk with the patients, and then when the conversations happen to be of a clinical nature, we automate them through our software algorithms that implement clinical best practices, as well as reporting and predictive alerts to stakeholders like clinicians or caregivers or family members.
So it's Jerry, it's not just one. So Victor, GeriJoy is not just one way, right? So you're sending this information, you're engaging with the patient, but you're also collecting data back?
Exactly.
Wow! Tell us more. So, what does it look like? What am I viewing? If I'm a patient at home, what am I seeing?
Well, we have a variety of avatars. So the beauty of having an avatar front end for this team of health advocates is that it can look like anything. And so we actually started based on my family experience with my grandmother, and we have a history in dementia care and senior care. And so we have a couple avatars that take the form of this GeriJoy dog, and a couple dogs and a cat, actually. And so there's a lot of benefits to that because it's a more lighthearted, kind of non-judgmental kind of a relationship that we can build. But it can look like anything, and we're building new avatars as well.
That's great. And so is part of the reason you started a company was to help prevent or help stop readmissions so the patient can stay home and convalesce? Or is it not just for convalescing? Is it for patients ongoing for months or years using the product?
Yeah, that's a great question. So when we started the company, it was really around addressing social isolation, providing engagement just purely from a social and psychosocial point of view for example, dementia care, right? So then what we noticed is that we have such a powerful patient engagement platform at GeriJoy that we can use it for other things. And as it turns out, preventable hospital readmissions cost the U.S. healthcare system $26 billion. Every year.
Oh, did you just say? Did you just say $26 billion?
I just said $26 billion.
Wow.
And with any luck, it's slightly less this year because there are incentives in the Affordable Care Act to lower that number. But the latest report is $26 billion. Yeah.
Wow. So, all right. So let's go back to the patient experience. So as I'm looking at my avatar or the dog, am I engaging with it? Like, what am I doing with it? Give me an example of how I'd engage.
So in a typical use case, so we're actually running a program with a medical center in South Dakota where they take the device home. It's a tablet. They take that home from the hospital when they get discharged, and when they get home, if they forget the dog will actually wake up and ask them to please plug them back in to the wall outlet. And then it's just on all the time, 24/7 in the living room where they spend a lot of time. And, for example, when you walk in the living room, we might welcome them home, say hi, start a conversation. And we do a lot of conversations about family, life, what it was like growing up, religion, things like that. But then we also throw in these clinical reminders. We might say something like, hey, also, did you take your weight yet today? And if it's a heart failure patient, we'll ask what the weight read and compare that to the last number to make sure they're not gaining water weight, which is very dangerous for heart failure patients. Or, if they're diabetic, we might be reminding them to check their feet for diabetic foot ulcers, things like that. And so we blend all of these clinical tasks in with this fun, engaging personal relationship. And so that's very, very powerful.
So I got a question for you. But actually, Dave has a question. Dave, what do you want to ask Victor?
So, Victor, I mean, a lot of this, we're talking about adherence, right? It's that adherence is a big problem in healthcare, and it's a big financial problem. So how does this help with adherence? Are you talking about meds, or it reminds you to take a med, or things like that?
Mm-hmm. Yep, it helps with the reminders. So the thing is, it's very easy to issue a reminder. Any tablet with an app on it or a scheduling system can issue a reminder. But there's a lot more to getting somebody to follow their plan of care than just reminding them. There's activating them and engaging them and actually creating a social relationship where to them it's more than just a reminder popping up on the screen. It's somebody that cares about you, trying to get you to do something that's good. And so the power of having the GeriJoy avatar giving the reminder is that the patient sees the GeriJoy unit there as an actual friend instead of just some software kind of in a cold way providing a reminder. It's saying, hey, Jane or Bob or what have you, by the way, after talking about her daughter or something like that, have you taken your afternoon medications yet? So it's a very different kind of a reminder, and it goes much beyond just the rote reminder.
Right, but I also, one of the things when you showed me a demo of it that I really liked is I think there's a fetch capability. So if I'm home and I want to see pictures of my kids or my grandkids and my loved ones, the GeriJoy dog, in this case, would be able to fetch it for me?
Yes. So we have a family portal where family members can add this kind of content. We've added music as well. You can add familiar voice recordings. So this all helps to engage the patient, particularly in older adults who might have some memory impairment or some cognitive impairment. It's very, very helpful to do reminiscence and to provide that emotional engagement and that social engagement in addition to all of these other self-care reminders.
So let me ask you a question for my audience again. We have a big health care community listening. We also have a lot of investors, and we have the consumers listening. So if someone listening has a mother or a grandmother, what do they do to get involved with this? And if there's a physician out there who thinks this is really cool or really, something that could really help with their patient population, how do they get in touch with you? And who are you actually marketing to? Are you marketing towards physicians and payers and organizations, or are you marketing to consumers?
We are primarily marketing to providers. But if you're a consumer and you want to use this for your mom or dad, that's fantastic, and we can provide a ton of value to families through our family portal, which also allows you to have a much better idea of how your loved one is doing day to day. And you can sign up directly on our website at gerijoy.com/families, and there'll be some information there. Or you can just shoot me an email, Victor, VICTOR, at GeriJoy.com. And so we're available that way, just online. But what we're really working on is programming with providers. So, for example, we have a program with a medical center in South Dakota where we're actually helping right now to keep a rural Native American population out of the hospital through our program. And so this is the kind of program that we're really excited about scaling across the country to a variety of hospital and health systems.
So what's next? What's next for GeriJoy? What's the next generation of the technology, or what do you plan on doing in the rest of this year? What's the goal?
So the goal is to scale up. We have a lot of great case studies and testimonials and use cases, and basically we just need to replicate this to more patients, to more providers, and we want to be able to get enough results that we can actually present some statistically significant data. And so we're actually working on a number of studies as well. So if anybody's interested in demonstrating improved outcomes for your patient population, that's something we're definitely interested in working on, and we have partnerships with some of the leading academic organizations that are working on this as well.
And I want to tell my audience, you should go to the website at GeriJoy. You should look at some of the videos. It's amazing. And if you go to Google, you got to watch his TED Talk. Victor gave one of the best TED Talks that I've heard. It was compelling. It's an amazing company. He built a business from his heart. And when I come back from my break, I want to talk to him how he created the business. But I want to remind everyone you're listening to HealthTech Talk on 640 WGST.
Hi, I'm David Nicholas, wealth coach and financial advisor. We live in a world where billions can be lost in a second. Are your retirement accounts protected? Are you tired of your money barely earning 1% at the bank? Are you frustrated with the ups and downs of the stock market? There's a better way. I'll show you what we do for our clients to protect their principal and maximize their returns. So give us a call, 404-890-5606. We're going to give you 1 hour of our time and waive the cost. 404-890-5606.
Easy, you're on the freeway.
Sorry, I've never driven a car before.
What? Back at the dealership, you knew exactly what you were doing.
Oh, I know I'm an excellent candidate for a car loan. I pulled an 809 FICO score at Experian.com. I've just never been behind the wheel.
You know how to buy a car, but you've never driven one?
Pretty much. So if I buy this bad boy, I'm going to need you to throw in some driving lessons.
Get your credit swagger on. Become a member of Experian Credit Tracker and find out your FICO score powered by Experian. FICO scores are used in 90% of credit decisions.
Tune in for hard-hitting advice as I tackle your toughest consumer problems. I'm consumer investigator Dale Cardwell. We're watching, we're telling on Trust Dale Radio and taking your calls. Weekdays at 5 on Talk Radio 640 WGST.
Hey, what are you doing this summer? Playing some ball? Going to the pool? Working? How about taking a college course? You can do it all, and Chattahoochee Technical College can help. Online college courses to fit your schedule without cramping your style. Visit chattahoocheetech.edu for course offerings. Application and document deadline for summer term is May 22nd. Again, that's chattahoocheetech.edu. And May 22nd is the application and document deadline for summer term. You can do it all, and Chattahoochee Tech can help.
Hey, this is Mara Davis, and right here on 640 WGST, we talk food 11 to 12. Don't miss us every Saturday, 11 to 12 on 640 WGST.
Sometimes it's good to just stop, take a deep breath, calm down, and listen to Talk Radio 640 WGST. Atlanta's compelling talk.
This is Cleve Gaddis. The Call Cleve Atlanta Real Estate Show on 640 WGST is relocating. That's right. We're moving to Saturday mornings at 9 a.m. But be careful. If you tune in, you'll quickly know much more about buying and selling and enjoying homes in Atlanta than any of your know-it-all friends, coworkers, or neighbors. You've been warned.
Ever have one of those days when the clutch in your brain goes out, your mouth won't work, and you cannot find a good attitude to save your life? Hi, this is Jeff Foxworthy. When I have a bad day, I try to remember those kids that I have visited who are fighting cancer. Their little bodies are weak from battling this dreaded disease and from surgeries and cancer treatments, but they're not sad or down. Incredibly, they have this great attitude that they're going to beat the tar out of this monster, childhood cancer. They believe they'll survive. In their courageous hearts, they believe we, the grown-ups, will do something about this monster. They believe and trust in us. If these kids have the heart to keep fighting and living, then the rest of us must have the heart to help them. Your donation to Cure Childhood Cancer will help fund the life-saving research for kids who are battling and believing. It'll make your day. Donate at curechildhoodcancer.org.
I got smart about mortgages. Now, it's my house I go home to.
I got smart about college. Now my kid's off to a great start.
When it comes to your money, whatever you want to get smart about, you can find it at smartaboutmoney.org.
I got smart about health insurance. Now both my finances and I are healthy.
Smartaboutmoney.org is a free online resource from the National Endowment for Financial Education. We're an independent nonprofit foundation dedicated to helping people just like you get sound information about money.
I got smart about protecting my job. Now, I'm doing better than ever.
For everything from how to build an emergency fund to how to deal with job uncertainty, smartaboutmoney.org has the answers you're looking for.
I got smart about credit cards. Now paper or plastic has a whole new meaning.
meaning. Smartaboutmoney.org. The easy place to start when you want to get smart.
Welcome back, and if you're just tuning in, you're listening to Health Tech Talk, broadcasting from iHeartRadio Studios, 640 WGST. I'm Ben Chodor, and we've been talking with Victor Wang. He is the CEO of GeriJoy, a really amazing company. First two segments, we've been talking with him about the business, what the product does. But I want to ask him as an entrepreneur. So, Victor, you started out at Blueprint Health. You got some seed money. You raised some institutional money. How hard was it, and what advice can you give my audience of, entrepreneurs out there of starting a business in healthcare?
So it is pretty hard. It's not the easiest industry to gain traction in because of, regulation, because people need, by nature of the industry, need to play it very safe. You're playing with people's lives here. So, it's definitely, you need to really understand the industry. So actually that's what we've spent a lot of time doing is really just figuring out the industry, how exactly all the financial incentives work and the payment models, and how we can, sell this in this industry in a way that is, providing value to somebody that's going to pay us and is not, for example, cannibalizing an existing business or anything like that. There's a lot to figure out around, one, we've always had a product and service that benefits patients.
Yes.
But then figuring out how to actually sell that within the industry is the big challenge.
So how does GeriJoy make money?
So we've done some sales within the private segment of home care and assisted living, just in the realm of senior care. And we've actually noticed that while that has been working, we've actually been having an easier time getting paid to do things related to reducing hospital readmissions, even though up until recently we haven't been focused on that. It's been more of a side project. And we've just noticed that, hey, the side project is getting us paid. So, and as it turns out, it's because of the Affordable Care Act. There's a ton of financial incentives around reducing hospital readmissions. And, in fact, it aligns very closely with what we've been doing this whole time with senior care. And because a lot of these people with multiple comorbidities going back to the hospital, they are older adults, and very often they have, for example, dementia, which complicates things dramatically and is not adequately addressed by a lot of these, readmission prevention programs that are in existence currently.
So if I ask you to give my audience two pieces of advice, if someone's out there and they have an idea to build a product or an app or something in the healthcare space, what are two pieces of wisdom you can give them?
One is to start, because a lot of people talk about ideas, and that doesn't necessarily go anywhere until you just kind of tell all your friends and colleagues that you've given up working and you're full time on your startup doing something, and then things start to happen, because then you're committed and you really have a startup and people start helping you out and things really start rolling. So one is to just start if you have a good idea, and then really commit to it. And then another is to really spend a lot of time talking with your potential users and customers, and like really understanding them before just kind of pitching them on your idea, because the industry is very, very complex, and if you're a first-time entrepreneur or you don't have a long history in the healthcare industry, you want to spend a good chunk of time just really, really understanding exactly the workflows that your potential customers are going through, all that stuff. I think a lot of early-stage startups don't do enough of that.
I agree 100%. Victor, I want to thank you. I want to remind our audience that Victor Wang is the CEO of GeriJoy. You can check out GeriJoy at www.GeriJoy.com. It's a really amazing company and amazing product. I wish you nothing but success. You're one of my favorite entrepreneurs in the world. Thank you so much, Victor. And now it's time for me to make a segue into